Hello, everyone. Well, we are going to be talking about anxiety because this is something that is happening all over the world. We are hearing news about Turkey COVID going up, India going up. I mean, it is really, really heartbreaking for all of us. So that's why we wanted to talk about anxiety, how to manage anxiety, what exactly is anxiety. So we have Dr. Allie with us, a naturopathic doctor. Welcome, Dr. Allie.
Thank you so much.
Yes. So, as you know, this is going on all over the world and people are feeling so anxious. And I am originally from India and I'm talking to my family members. And it is so heartbreaking, when I talk to my friends and families, it is mayhem, right? In a lot of the part of the world. Just breaks my heart. So what can we do? How, just tell us what can we do? I'm,
Well, yeah, that's
I
a great
know.
question. The
Yeah.
$1 million question, right? So,
No.
I mean, anxiety, it really, manifests in two ways, right? So we have our mental emotional symptoms of anxiety. So just
Yeah.
not feeling like you're in the present moment,
Yeah.
worrying, thinking about the future. And then
Yeah.
we have our physiologic, like somatic,
Yeah.
responses to anxiety. So heart is pounding, we're sweating, we
Yeah.
can't really find our bearings, we just feel kind of out of body, right?
Mm-hmm.
So with anxiety, it's really important to understand, what with anything really, what the root cause of that anxiety is, right?
Mm-hmm.
Because the way that I see anxiety is that it's kind of a symptom. It's a symptom of something else that's going on in the body,
Yeah.
whether it's from that mental emotional level or if it's from a physiologic level, right? So the
Mm-hmm.
first thing is understanding like what it is, for that person, right? And
Yeah.
so with COVID and the news and everything like that, that
Mm-hmm.
has to do with more of a nervous system response to anxiety, right?
Yeah. Yeah.
Somebody just taking something like a news report and becoming super like ruminant about it, and
Mm-hmm.
really making it taking them kind of away from themselves, right? So it's like, how do we bring you back into your body?
Yeah.
So that would be my approach for that, right?
Mm-hmm.
So when it comes to that, it's really about the vagus nerve, right? It's really
Yeah.
about our sympathetic and our parasympathetic, and
Mm-hmm.
we hear that all the time, like the fight and flight nervous system and the rest and
Mm-hmm.
digest nervous system. So
Yes.
what does that mean? It just means that, evolutionarily speaking, we have, our brain is wired that way. Whether or not, we consciously are telling ourselves we're calm, if
Yeah.
we get triggered in a certain way, our nervous system will respond. So
Mm-hmm.
we have to understand the input into our nervous system that will bring ourselves back into that state of rest and digest, right?
Yeah.
So with bringing yourself into that rest and digest or parasympathetic state, we're
Mm-hmm.
talking about stimulating the vagus nerve. So we're looking at breath work, we're looking at meditation, all those good things.
Yeah.
Also anything that is like mechanically stimulating, the throat where the vagus nerve runs.
Yeah.
So, things like singing, gargling water, laughing, chanting, anything like that.
That just to activate, right? This particular one that helps you calm down. So you're a naturopathic doctor. So
Yeah.
what kind of techniques you use to help your clients who have these anxiety?
Totally. So there's a lot of things, right? So if we're
Yeah.
just talking about like nervous system stuff,
Yes.
I'm always about breath work, right? Because a lot of times when people are anxious, they're either holding their breath or they're hyperventilating.
Yes.
So, or they're breathing in their chest. So how do we get you to bring your breath back into the belly? So we really want to breathe into the lower belly. That's the area below the belly button, right?
Okay.
So lengthening the inhales, but even more importantly, in terms of
Yes.
stimulating the vagus nerve, lengthening the exhales. So you can do put your hands below your belly button and take a long deep breath in for about 7 seconds, and
Okay.
then exhale for eight to 9 seconds. Exhale is always longer than the inhale. So breathing into your belly on the inhale, and then exhale, bringing the belly button in. And just doing that for like 2 to 3 minutes can really reset the vagus nerve and put yourself in a little bit more of a parasympathetic state.
Okay. And then as a naturopathic doctor, do you also use like food and herbs, as part of this toolkit, or it's only just the breathing part, or some of the other things like, massage and acupuncture? What are the other things that we should think about?
Totally. So, the breathing stuff is really just like an in the moment thing, right? Like that's how you shift yourself, because it really is about shifting yourself in the moment. But in terms of a root cause of anxiety, a lot of things can give you a propensity to have anxiety, right? So we were talking about like copper overload. That's one of many things. You know, not everyone's going to have copper overload, but copper overload, it's basically a metal in your body, and it's associated, you know, a lot of women who have copper overload also have estrogen dominance. And what copper does is it takes the neurotransmitters in your brain, and it basically takes dopamine and it shifts it to norepinephrine and epinephrine, aka adrenaline, which is that fight or flight neurotransmitter, right? So if you have high copper, you really want to get that down so that that is not kind of in the background, right? You know, another thing would be gut health. So we all know that the brain and the gut are connected. And so just being intimately aware of, you know, are there any symptoms in your gut, like bloating, gas, diarrhea, constipation, abdominal pain, and understanding, like, is there a dysbiosis, or is there something going on in the gut that, you know, needs to be addressed so that we can, you know, improve the brain as well, right? Because whatever's happening in the gut is being reflected in the brain. Leaky gut, leaky brain. We have the vagus nerve going from one to the other. So that's another really big one. You know, another one is hormones, right?
Yes.
So, you know, PMS is like, you know, the classic example, right? So a week before your period in the luteal phase, it's, you know, if you don't have if you don't have enough, you know, progesterone, which is, you know, that calming hormone, it binds to GABA receptors and it makes you feel relaxed. Or if you have too much estrogen in relation to progesterone, you're going to feel anxious. You're not going to feel like that calm state that really should be felt in that luteal phase if you were balanced.
So you touched upon the copper overload a little bit. So what causes the copper overload? And I was reading on your Insta post, as I was telling you earlier too. What is the reason? I mean, is it all this toxic environment and that's
so copper in our environment can definitely cause copper overload. So, you know, if you have copper pipes in your house, that's a really big one. If you have zinc deficiency, that can increase copper, because zinc and copper are kind of seesaw hormones, and a lot of people have zinc deficiency. Zinc is also important for making neurotransmitters like serotonin, right? So if we're deficient in zinc, we're already not making our happy hormone, right? Or our happy neurotransmitter. And then, you know, estrogen dominance is a really big one. So estrogen can cause copper overload as well. And so addressing copper overload, I mean, first thing you have to do is obviously, you know, test for it. And if you do have it, depending on how, it's really the free copper percentage, right? So depending on how high that free copper percentage is would depend on how aggressive you are. So definitely working with somebody who like understands that, right?
So there's a correlation between the copper overload and anxiety. I mean, that's the what I'm trying to kind of make people understand, right? But then so the copper overload, the way you can find it is by getting yourself some kind of a test to understand the heavy metal test or whatever the test may be, then to understand what the copper overload is there within your body or not.
Exactly.
Okay. All right. So what other naturopathic treatments that you would recommend? We're talking anxiety here, obviously.
Totally, yeah. So, you know, depending on the root cause, right? If somebody's got PMS, then I would definitely do some advanced hormone testing to see see what's going on there. If they have gut issues, then I would do some testing there, maybe a stool analysis or a SIBO test, you know, depending on their symptoms, and address it from that level. I know you mentioned, I think we were chatting before, you mentioned herbs, right? So herbs for anxiety. And I think herbs are another great acute treatment for anxiety, right? So we're talking about like shifting our nervous system with our breath and everything in the acute stage, but also, you know, herbs can be a great way just to bring yourself back into that calm state. It might take a couple hours, right? It's not going to be instantaneous, but, you know, some of my favorite herbs would be like lavender, skullcap or scutellaria. Let's see, I like Avena sativa, which is milky oat. So that herb kind of falls in the category of nervine or nervine herbs. And those really address the nervous system and kind of relax and tonify the nervous system. So any herbs that are under that nervine category are really what I like to use to kind of calm and restore. Because usually, you know, when people have anxiety, they have a lot of things going on in their life. They're overstimulated. So the nervine herbs can really kind of nourish and tonify the nervous system.
So someone's asking a question. What are signs of copper deficiency in post-menopausal women? That's the question.
Oh, copper deficiency. So I don't really see copper deficiency that much. Usually it's copper excess. Usually we're low in zinc and we have high copper. I've seen copper deficiency in young kids, but that's kind of a different scenario.
There's an overload of copper in postmenopausal women also. I mean, is there a kind of a correlation after menopause that women might have more copper?
Totally, yeah. I mean, generally, it's associated with higher levels of estrogen, and in menopause, your
Yes.
estrogen drops, right? So, but I have seen it. I have patients who are postmenopausal and have copper excess. One of them I'm thinking of, has copper pipes in her house, right? She built her house and she thought that copper pipes would be a healthier alternative, and I tested her free copper percentage, and it was like 40%, which is really really high. So really for her, it's in her house. So we're just doing everything we can to increase her, ability to get it out of her body.
Sure. But do you think the makeup that all of us use, or some of the things, like most of the women obviously use more makeup than men, or is there anything else that could also contribute to the copper overload in our bodies?
Totally. Yeah. So like makeup is, I mean, depending on what you use, right? If there's any endocrine disruptors in there, right? Any xenoestrogens.
Yes.
So like in plastics and in our tap water and, phthalates and parabens and all those things in our body products, in our beauty products. If those are in there, those could potentially, introduce xenoestrogens into the body, which could exacerbate exogenous estrogen exposure, which could then increase our levels of copper. So
Yeah.
totally. Yeah. So definitely like cleaning up your life situation. I really like looking at Environmental Working Group, or EWG.org. That's a really good resource. And then also there's an app that you can have on your phone. It's called Think Dirty, where you can literally just go and scan, products.
Yeah.
Mm-hmm.
Well, hopefully we answered that question. If you have any follow-up question and comment, please feel free to put it out there, and we'll take it. Yeah, so I think this is really good information, right? I mean, depending on who the client is, whether it's a PMS or the menopause, or of course in a situation like this where the COVID is obviously causing anxiety, because watching news, there are different type of anxiety, as to your point, right?
Totally. Yeah.
Yeah.
Yeah. And, somebody with a physiologic, propensity, they already have, underlying copper toxicity, or, their hormones are off. They're going to be more affected by something like that, right?
Yeah.
Or somebody with a nervous system that's just in fight or flight, they're going to have less nervous system resilience. And so with that person, you want to build resilience. So it's all about like kind of where you're at. So if you're already in a place where, things are kind of imbalanced, then I would recommend, doing a social media detox, doing a news detox, where you focus inward on yourself, right?
Yeah, yeah. And that's probably what is needed right now. I mean, I know it is very addictive to keep watching news and understand what is happening in the world, but maybe, to calm yourself is what is needed for so many people who are suffering right now in the world.
Yeah, definitely.
Yeah, there's another question. Okay, what are side effects of taking too much zinc in supplements? It's been recommended for COVID prevention.
I'm sorry,
Okay, so the question is, what are the side effects of taking too much zinc in supplements? And zinc is recommended for COVID prevention.
Yep, it's definitely recommended because it's going to help with the viral replication, or stop the viral replication. So you definitely don't want to take too much zinc, because you can really screw yourself up. You can make yourself, it can cause like downstream anemia and like throw off your zinc copper levels. So there's really, upwards of like, I mean, depending on like 30 to 50 milligrams a day is really what's recommended. So side effects of taking too much zinc long-term could be the things I just mentioned. Short-term, if you're not taking zinc on a full stomach, zinc tends to cause like nausea and stomach upset. So the form of zinc that I always recommend is the elemental zinc, which is zinc picolinate. And that one is just more bioavailable, and it tends to give people less issues if you take it with food.
Okay. Well, let us know if there are any follow-up comments or feedback. I love the interactive part, that people asking questions. I think it just it's great. So let us know if before we wrap up that we've answered your question. If there are any more questions, please let us know. Okay, anything else, Dr. Allie, that you would like to add?
No, I think we pretty much covered it in terms of just an overview, right? It's just
Yes,
looking at, you know, what it is for that individual person, and then, you know, in the moment to moment things to help.
correct, correct. No, I think we looked at different aspects of anxiety depending on the symptoms one has accumulated, and then the short-term anxiety, what is happening right now in the world, versus sort of like a prevalent, right? That's been prevalent in someone's body for due to PMS or menopause or what have you.
Mm-hmm.
So these are different type of things that you would attack, right? Understanding the type of anxiety, and then you'll attack according to that. And that's what I'm understanding, right?
Totally. Yeah. Yeah. And then trauma is another one too that I didn't mention. I'll just throw that in there. Like if somebody's experienced trauma and they're, you know, fight or flight or freeze, that's another big one as well.
Yeah, and which a lot of people are, right? Experiencing
Yeah.
trauma.
So many.
Yes, yes. Well, we were not talking about trauma right now. I think it's a huge topic. We just wanted to bring on anxiety and talk about different type of anxieties and how you can tackle. To all the people out there, our hearts go out to your loved ones, to your families who are experiencing anxiety right now. We are just trying to help. That's all we are trying to do. With so much, yes, gratitude.
Yes.
Thank you. Thank you so much. Thank you, Dr. Allie.
You're welcome. Thank you.